Welcome to another episode of Make Mental Health Matter. I am your host, Kelli Melissa Reinhardt. And if you are watching for the very first time, make sure if you're watching this on YouTube that you click down that subscribe button. If you're watching it on any of the streaming platforms like E360, Apple, Fire, Amazon, whatever it happens to be, I know the name because I was streaming this weekend. It's your watch list, or there is a want to watch later list, basically. So I've been trying to figure out the name of that forever, but I finally figured it out. Watch list. There's a watch list. So you can put us in there so that you don't miss another episode, because I promise you, and I say this every single week, but really, truly, every guest that I have on is incredible. And the whole point of Mondays is to bring resources and information to you as the viewer, because oftentimes in the mental health space specifically, there are a lot of resources, but sometimes we just don't know what they are. And so that's really the whole point of Mondays, is to give you those people resources, whether they're inside your community or you can access them outside of your community. So without further ado, I am going to bring up my guest for today. James, thank you so much for joining me.
Yeah, of course, Kelly. Good morning to you. Thank you so much for having me on. I appreciate it so much.
Absolutely. So I know I it was going to be you and one of your therapists, but maybe she wasn't able to connect. So we'll see if she joins us here in a little bit. But either way, tell the audience a little bit about yourself and what you do.
Yeah, so my name is James Garofalo. I am the co-founder and CEO of a new intensive outpatient mental health clinic here in Colorado called Collective Health Partners. We just opened our doors last month, and we're basically seeing folks for providing intensive services. And so most of our members who come and join the program are typically seen for about 9 to 10 hours a week, usually 3 hours a day for 3 days a week, and in cohorts of about 8 to 12 week cycles. So we're really excited to have our doors open and to start getting to work here.
Yeah, that's amazing. And I'm curious, what got you into wanting to do this work?
Yeah, so it's a question that comes up a lot, and I think I found my first sort of or I should say, interest in the mental health space and sort of recognize its importance when I was in the military. I'm a veteran. I served 4 years active duty Army from 2006 to 2010, and so I deployed to Iraq in '08 and to '08 to '09, and when I was coming back from deployment, I always tell people, and it's kind of humorous, and if you're in the military, you certainly know what the saying, but I always tell people I was voluntold to kind of work with troops who were coming back with different issues, substance use, issues, and some trauma. And I wasn't a therapist by any means. It was kind of just a slot they put me in, because they knew I was getting out, and there was a big need for it, and so I was kind of just a case manager. And at that time, I was really kind of against it. I always tell people I was a macho 21-year-old and didn't want anything to do with, therapy or counseling, but ended up doing it for about 9 months before I got out and just fell in love with it. Even as a case manager, I recognize the importance. It was really just connecting soldiers with resources, and yeah, the rest is history. And so I got out and did some schooling, and kept finding myself in different spaces in the community, and eventually starting some of my own practices in time.
Wow. And well, I mean, we literally just celebrated Veterans Day, so thank you for your service. And yeah, kind of like that voluntold, right? Voluntold to do that, but I think that it's one of those I guess the thought that pops in my head is those divine guidance is it's not necessarily the journey that you expect to take, but it is a journey that leads you into now what you're doing by opening this new center that ultimately I know it's going to be amazing and be able to serve so many people. And can you tell me just a little bit more about what it means, like intensive, um having that intensive piece to it?
Yeah. So I'm happy to. So I think the easiest way I can explain it is, when you look at treatment in terms of mental and behavioral health, it should be seen as being sort of a spectrum. I think a lot of people, they know about traditional outpatient therapy where you see your therapist, once a week. And then I think some people know about inpatient facilities, but there's actually a couple different levels of care in between, those opposing sides. And so in the middle, right, in that spectrum is intensive outpatient programming and then also partial hospitalization programs. And so collective health partners is what we call an IOP for short, right? An intensive outpatient program. And so it's really intended to bridge the gap of services between that spectrum. And it's my team and I feel it's a much needed, level of service here in the state of Colorado. And so, we're excited about it. So we think it's going to do a lot of good for a lot of folks.
Yeah, so one of the um women that help me often, we're really diving into with my nonprofit, we're really diving into the recovery space. And I know the first time she said IOP and I was like, I have no idea what you're talking about. I mean, I'm in the world of mental health, but there's so many different acronyms, and that's why I wanted you to clarify, because some people when they hear intensive, right? Like they're like, no, that's not what I'm doing. I mean, there's like this fear base that happens, and that's why I think that these conversations are so important, because it doesn't have to be something you fear. It can be really, really beneficial for those that need it the most.
Totally. I couldn't agree with you more. Unfortunately, the healthcare industry, specifically the behavioral healthcare industry, I think is really plagued with a lot of stigma, with a lot of misconceptions and mischaracterizations of treatment. But yeah, if I could send any message to folks, it would be not to allow that word intensive to scare anybody away. I mean, usually programs like ours are really intended to be flexible with your schedule. Oftentimes, either before you might go to work or school, or after you might go to work and school, there's a lot of evenings and weekends availability, and it's really just to serve as a little extra, level of care for folks who need a little more support, while also serving as a really effective transitional period for folks who might be coming out of inpatient facilities, might be coming out of those partial hospitalization programs. Again, it's really about sort of filling in those gaps.
Yeah, definitely. And I I know also in talking to several people that one of the questions is usually, do you want to go inpatient or outpatient? And most of the time, everybody says outpatient, because inpatient may sound kind of scary also, because you never know where you're going to go, how you're going to be treated there. There's so many different levels that you have to consider. But I think that, and in talking to a lot of people that even come on the show, is that when you really truly need help, there are lots of places that you can go, and you don't necessarily have to go with that first one, or, like there's just different levels. And if you really truly are struggling, then I think like something like the intensive outpatient is really beneficial, especially like you said, coming out of hospitalization or an inpatient, because we need that aftercare. And a lot of people, unfortunately, don't take advantage of that. I feel like, I don't know, I may be wrong.
No, I mean, you're not wrong at all. I think education is like the biggest, one of the bigger hurdles. It really just educating folks on the resources. And I do think if people knew more about the resources available to them, there would be more engagement. I think there'd be less stigma. But unfortunately, what's not talked about, leaves the brain to come up with, assumptions and things like that. And so, yeah, I think education around what's available, and understanding that your treatment plan can consist of multiple different types of treatment and opportunities that can really benefit all of us. And so I don't think you're wrong at all. I think it was spot on, and we can only hope and do our part to destigmatize and to educate.
Yeah, that's one thing. I mean, with my nonprofit, it's all about education. I mean, we fit more in the pre-crisis, and then when somebody will, if they're non-crisis or crisis, we like to pass it over. But ultimately, I mean, that education, like you said, is so key to know what is available. The waiting lists have gotten a little bonkers, but then there are other places that are opening that are new that don't have a waiting list. Like eventually they probably will get on one, but ultimately, yeah, that's like the whole point of the show, is giving people more resources, more information, and knowing that they don't have to be fearful or stigmatized when they go into places to ask for help.
Totally. Yeah, yeah. I think the more people talk, I've been in the field fairly consistently, over the last 10 to 15 years even. And in many different roles, mostly administrative and a much more entrepreneurial than clinical. But even in that time period and in those role capacities, I felt that I think culturally we're starting to see a shift. I think we haven't quite arrived yet, but more conversations are coming up, particularly with sort of the next generation of young people, young leaders, and that's great, right? Because that gets passed on, that gets really absorbed, and it's starting to break down some of those walls.
Yeah, that's a great point too. And I've had these conversations with a couple other people, and I am so hopeful for the future because finally youth in general are actually talking about their mental health. I think it's actually the older generations that we're now trying to get on board because we're like, we need to talk about this. And they're like, no, don't talk about that. And you're like, no, really, I need to talk about this. So I am very
Totally.
hopeful with where it's going now.
Yeah, totally. I do think we're starting to see a change, and we can only hope that it'll continue to linger. And I do think it will. I do think it will.
Yeah, absolutely. And I know it looks like Katie popped back in, but I can't see her. So we'll keep going and we'll see if she can get her video on and we can pull her up too. But so I am just curious, and I know like the it is in Colorado Springs. And so doors are open now, is that correct?
Yeah, so we actually have two locations, but we also have a very robust and very comprehensive virtual program as well. And so we can actually see folks all across the state of Colorado right now. Most of our providers, um, are of course licensed in Colorado, and so with our virtual capabilities, we can see folks, across the state within the state boundaries there. But for folks who do prefer face to face, we certainly wanted to offer that as an availability and as an option. And so we do have our main location in Colorado Springs, which is more like sort of north. It's kind of central, but I would say more northeast Colorado Springs. And then we're actually opening up a second brick and mortar location in Pueblo here right after the new year. We just finished up our lease down there and are really excited to open doors down there because there seems to be a good amount of need, and we certainly want to do our part.
That is amazing. And yeah, I have heard that, I mean, Pueblo and down south, they don't have as many or as much access to, which tends to, I mean, it's not really a rural area, but it kind of is. There are sections of Pueblo is so ginormous, but there's a lot of sections that they don't have access to a lot of mental health services. So that's amazing that you're opening another one there too.
Sure. Yeah, we're really excited about it. We're a startup, right? And so we're gonna make, we're gonna make some mistakes. We're learning as quickly as possible. I think right now we're just focusing on establishing really good partnerships and relationships, trying to earn the trust of the communities that we're in, and just trying to bring good to those areas.
Yeah. And that's one of the biggest things that, especially with my nonprofit. So, right now, we're building what's called a trusted resource hub. And ultimately, it was out of me not having and my team not having access to enough resources. Like we had a resource page, but it just went to websites basically. And I have always been very selective because I want to make sure that it's helpful and not hurtful.
Totally.
I would never want anybody to go somewhere that hurts them versus helps them. But the conversation also that kind of pops into my head, because people Sometimes it's hard for them to ask for help, and then having a newer type company, right? um there are some challenges that come up within any organization across the board. And I'm curious for just the people that maybe are untrusting is the word that's coming to my head. How do you help to smooth that over? That's probably not the right question, but that's what popped into my head.
Sure. No, I think that's a great point. I think, regardless, your question, it really applies to many different industries. I think many different sectors, of the startup and entrepreneurial space. And so, you know, generally speaking, I would say a big part of that is earning, you have to earn the trust, whether they be customers, clients, patients, whoever, those who you serve, those who you provide. You have to be able to satisfy what it is, that they're looking for. And so I think for us, I put so much faith and reliance in my team, in us as a team. Um, I believe that the providers that we have and the administrative staff that we have, within Collective Health Partners, although we're small yet, I think we have a team of 10. I think we're onboarding a couple more providers after the new year, which we're really excited to be getting. But really, it comes down to, the providers and the incredible work that they do. Even in my role now, I still believe that admin is we're there to support, the clinicians. That's our job. And so if we can bring in outstanding providers who are super passionate and motivated, then that energy is they're the ones interacting with the clients, and so that's going to inevitably, I believe, and certainly we're hoping, and history would suggest that it's accurate, that it'll earn that trust, right? It'll earn those opportunities for the community, whether it be partners or our patient our caseload, that trust will be established.
Yeah, it's definitely something that I think everybody across the board really has to consider. And like you said, taking care of your therapists and your staff and everybody, I think that's key. And another, my brain just shifted again, is caregiver or mental health professional self care is a huge factor that I think oftentimes those that are struggling, like they really, really want help and support, and they finally muster up um this energy to be able to ask for help, and then maybe they're thinking that it's going to go a different way than it goes potentially, right? But we also have to look at the flip side, like how do we take care of mental health providers and their self-care and making sure that they're okay to be able to give back to more people too.
Yeah, that's a tough one. That's for sure. And when I hear you, speak to that, it's for me, it's a sort of a dual parter, because, certainly I have staff, right, and a team that I need to be mindful of, and making sure that they're finding opportunities for self care. And when you're in a startup environment, it can be very intense. I mean, it can be very long days, a lot of work. Um, and so I do think finding that space is absolutely important. Now, on the flip side of things, I used to do, I was a provider. I did I'm EMDR trained, and so I used to do EMDR with soldiers, and I'm an addiction. I haven't practiced in years at this point, but when I was, that of course was a big part of it, and so I can kind of see things through that lens as well. When you're working with your clients who are really engaged in some heavy topics, as we all know, yeah, that's a lot, and a lot of folks can kind of lead, that can lead to a lot of burnout. um, I can't tell you how many providers I've seen kind of come in and out of the behavioral health space, because they'll get burned out, and then that passion's still there, and then they'll kind of come back in, and then after a couple more years, kind of get burned out again. And so how to stay on top of that, I mean, is really, I think, about um, kind of like forcing yourself to put time on your calendar, right? Really being mindful to that. And it's very easy, especially if you're passionate about anything in life, to get really consumed by that, I think, and really get absorbed into that. But you know, sometimes I think it takes really being aware of that, and if you're not going to do it to yourself, then I think it's maybe your leadership or your peers to even step in sometimes and say like, hey, you know, when was your last, you know, weekend where you didn't work, or your last vacation, or your last evening where you just kind of relaxed? So I think we can all help each other.
Definitely. No, and that, I mean, such a good conversation to have also. And I know in the mental health and nonprofit space, I've had to often with some of my board members be like, hey, so when was the last time you actually took a day off? I mean, I know you do things outside of what we do, but like really, truly, you need to shut off your phone and just take care of yourself.
Totally. No, it's so important. It really is. And it's glad that you have the team that, you know, and the environment that you can do that.
Yeah, it's we've had to get up to that point, right? Just like, I mean, being in the mental health space and understanding, and I know that like businesses have, they still have day to day to run, and being mindful of each other, patients, all these things. Like, there's so many things to juggle, and the same goes in the nonprofit space. So, definitely, it's one of those, you get to that point that you have to be understanding and observing what else is happening within the company and the environment.
Totally. Because when was your nonprofit founded?
I founded it in 2018. So
Okay.
yeah, I lost my middle sister to completed suicide in 2017, and
Oh,
then founded it in 2018.
gotcha. Gotcha. Well,
Yeah.
I'm sorry to hear that. I'm
Oh, thank
sorry to
you.
hear that. But to look at the, you know, the good that you're bringing in. I was able to watch some of the videos, and I love it. I love the topics. You definitely hit on some good stuff.
Awesome. Well, I appreciate that. And we're going to go to a quick sponsored break, but then once we come back, if you have any like tips or anything, any other direction that we want to go, we can go that way. So, we'll be right back after this quick sponsored break.
Hi there. Hi there, I'm Dawn Livingston, your host on the Transcend and Succeed show. Join me Fridays at 2 p.m. Central for limitless inspiration and ways to help you transcend your limitations. Tune into the Achieve TV network and the Voyage to Vitality channel. Transcend and Succeed show, right here on A360 TV.
And like that, we are back. I was telling James earlier, and for the audience, this is a newer streaming platform that I'm now using. So I don't have all of my sponsored commercials, like all the right ones in here yet. So that was pretty interesting. That was the first time I've gone to that, and how to do all the backside. So, see, live TV, it's one of those things that happens.
Oh, we're always learning for sure.
Yeah, absolutely. If you happen to be just joining us, thank you so much. Make sure if you are watching on YouTube, you click down that subscribe button so that you don't miss another episode. If you're watching on any of the streaming platforms, make sure that you add us into your watch list or your watch later list so that you don't miss another episode. And James and I are talking about really intensive outpatient, and specifically the collective health partners that are in Colorado Springs, and then opening a new facility in Pueblo, and really talking about you don't have to be scared to go into, well, it's not really like it's outpatient, but go to facilities and get this intensive outpatient if you're coming or transitioning from hospitalization or maybe an inpatient facility. And I think that's like the gap, right? Like where you guys are really filling that gap between when a person, how a person transitions out and then goes back into, I mean, the real world, right?
Totally. Yeah, if there's any fear around that, I'd really do. I always challenge people to think of it as just, is a slightly stronger resource for you, right? I mean, it's 3 hours a day for 3 days a week typically, and you don't have to, if you're currently working with a therapist or a provider, that's the beautiful thing about, IOP is that, we're really, at least for collective health partners, our model is about really coordinating and collaborating on care with your current providers. We want to ensure that you're going to stay with them. This is just an opportunity to supplement the already, the care that you're already getting. And then, go right back to your provider for the traditional weekly or whatever the case might be.
Yeah, I just think it adds this whole other layer because I oftentimes hear that the case management part is the missing part. And with somebody that really truly is struggling, and whether they want to like fully admit that they are or they're not, right? They still need that follow-up part. And that's what I think, or where I feel like the intensive outpatient comes in, is you really have that follow-up. It's much more organized and helps you make that transition because I feel like not everybody just wants to go inpatient right back to life. There's got to be something that fills that part, and that's what I truly believe you guys are doing.
No, totally. I think a lot of data would suggest, that a sort of transitional period is certainly best. And I think when we're talking about case management, yeah, I mean, you're not wrong at all. If it's really good, then it's great because you get really a care team of different providers, working on a case or as part of a treatment plan. But there's times when it's not so good, and then there's sort of a breakdown in communication between providers, and I think that's it's unfortunate when it happens because it's not a good situation, and I think people deserve better than that. Of course, I think we would all agree with that, and so yeah, case management and coordination of care is fundamental.
Yeah, that is, I think, see, you got my brain like thinking all these things. Um, I took a psychology class in college. It was abnormal psychology, and I remember a woman coming in and talking about her story. She actually had postpartum depression, and then with her second, she had postpartum psychosis, and she went into three different inpatient facilities, and then ultimately, what she now calls the incident, she murdered her two children because
Wow.
those three places didn't sync up to each other and there wasn't that case management that happened. They were trying to monitor her because they knew that she had postpartum depression, and then she also had it with her second one, but they didn't connect the dots going into psychosis. And
Wow.
I think that just in itself is horrible. But now she goes around and talks about her story because, again, it's something that we have to talk about. And people have to be aware that just because you go inpatient or outpatient, right? You can still have things that come up at a later time. So that case management part is really, really big.
Totally. Yeah. I mean, I think when done correctly, that's an intense story, by the way. Holy cow. So she was got like a guest speaker in your class?
No, yeah, yeah. She came to our class and spoke. Yeah.
Man, yeah, that's heavy. Yeah, I mean, that's a very unfortunate, example. I think when done correctly, there's a preventative component to it, and that's what everybody wants. So, if we can prevent some of these things from even happening, that's of course key. And so I think when you collaborate on care and you find appropriate partnerships and you focus on good case management, you get a stronger likelihood for prevention. And when you don't, and there's breaks between treatment, and providers aren't communicating and organizations aren't communicating, you unfortunately can even get outcomes like that, which is just, absolutely tragic.
Yeah, and unfortunately it happens more often than not. We just don't hear about it as much. She actually was in Colorado and she went to the Pueblo mental health facility. And so it was one of those stories that has always stuck with me that I remember hearing about. And I'm like, we've got to do better. And that's why I love bringing on guests like you, is like we have space to do better. And there are organizations and places that are doing better.
Totally. Yeah, I know. I would imagine that would have stuck with anybody who, heard that story. It sounds like a really impactful story.
Yeah. So I am just curious for anybody that is watching that maybe doesn't know um, too much about intensive outpatient, or like really even the whole process, but what does it take, or is there like certain qualifications for them
Yeah.
to come to you guys?
Yeah, totally. I'm going to break it down. You're using a new platform, so I'm going to give a new description to this process. So we can both try something new here today. Because over the last couple of weeks, we've been out doing some outreach and some community and networking stuff, and I'm actually kind of taken back by, um, how many people aren't, even in the field, aren't totally aware of what it is. And so what I'll kind of just walk you through the process a little bit. So. One of the things that I can't stress enough is that you don't have to leave your current provider. That's really a great aspect of this. I think a lot of people are already working with their therapists or whoever it may be, and they're thinking, well, I have this relationship, I have this rapport, I'm not going to just leave. And that's what we're not here. We're not here to do that. We're here to collaborate with your provider, and ensure that your treatment goes that much better. And so, really, for us specifically, for Collective Health Partners, all the information in the world about what we do can be found on our website, collectivehealthpartners.com. And you can also go to the website to fill out forms to get enrolled. And so basically what happens is, if we get a referral, or if you're a good fit, or if you think you might be, or somebody we would just have you come in, we would do an intake. And then during that intake, evaluate whether or not, this level of care would be suitable for you. And if it is, that's great. You'll continue your treatment with your provider, whatever that might be, whether it be weekly, biweekly, monthly. But our program will run, again, the 3 hours a day for 3 days a week, and then you'll be put in sort of like it's always done in a group setting. Typically, 6 to 10, participants per group. It's oftentimes specialized towards your needs, whether it be trauma, depression, anxiety. We're a newer clinic, and so one of our goals for 2024 is to really focus on establishing specialty track programs. And then after that, you become part of our alumni program, which is awesome because you're always part of the family. We always are hosting different things, providing resources, staying in touch. But all the while that's going on, we absolutely can be, and oftentimes are, in contact with your provider, just making sure that nothing's getting missed and that you're getting the level of care that you need and you deserve. How was that? Did that
Yeah.
paint a clear picture?
Yeah, no, that was great. And it is interesting how many people don't know and I think it also goes into everybody kind of has their own way of doing things in a way, but there is definitely a standard that is followed
Totally,
that people need to
totally.
be aware of. So yeah, for sure.
I mean, it's kind of like group therapy, but you just learn a ton. You're there longer, and so you get so many resources, and it's just a really incredible process.
That's awesome. And I think that's the biggest thing, is giving people the resources that they really truly need to be able to help them in the future if anything happens to come up, because I mean, we know that their recovery is possible across the board with a mental health challenge, depending on what you're going through, of course, right? But if we can really give the tools and the resources and all the information that somebody needs to be able to move through whatever they are going through. Because it's not just a one and done, right? Like I think a lot of people have this misconception that, oh, I'm gonna be great, like everything's gonna be
Totally.
fine. I only need help one time. But that's just not reality. Like that's not life. And so we really have to be aware that the more tools and resources that we can build in, the better outcome people will have.
Totally. Yeah. I think so. A big part of our mission is really recognizing behavioral healthcare as healthcare, right? And kind of like doing our part. And I think that's tied to destigmatizing it, but doing our part to recognize it as healthcare. And so, you know, it's to use sort of a frivolous example, like you don't brush your teeth once and then expect, to have healthy teeth forever, right? It's part of your care routine. It's part of your health. You have to continuously do that. And behavioral health, is really no different. And, consists of skills that only benefit all of us. And so, yeah.
Yeah. Mental health is just as important as your physical health. Love
Totally.
it. Yeah.
100%.
So I'm curious if you have any like tools or tips or anything else that you wanted to share that maybe we didn't get to.
Yeah, this would have been the part where Catie would have really shined because she's the clinician. She's got plenty of tools in her tool belt. But I will say this, and this isn't probably a much higher sort of perspective, higher level perspective on it. But I would challenge whoever is listening or would eventually listen to this. I would challenge you to not shy away from talking about it. At the end of the day, when the industry uh, looks to create the change that I think it needs to really to create shockwaves of good around the world, it starts by conversations. Avoiding topics, whether it be even with your own internal, dialogue or with other people, family, friends. Avoidance, I don't think is ever the answer. And so I would challenge everybody who listens to this to just talk about it. Talk about it when and where you can. Make it part of everyday conversation. Collective Health Partners has a hashtag that we've been using. It's hashtag talking to my therapist. And so we really are aiming to build that language into everything we do, and make that, really no different than when you say, I was talking to my personal trainer or talking to my, chiropractor, whatever the case may be. And so my challenge would be for everybody to talk about it.
I love that. And that's, I mean, one of our, at least with my nonprofit, one of our programs is conversation. We, because it's part of the conversation. You really, and I'm going to start using that hashtag because I know, like, I have a therapist. I also have a coach. Like, I have a mentor. I mean, I think that we all need those people in our life so that we can be as healthy as possible. And talking about having a therapist or talking about having a coach or whomever it might be in your life that you're able to talk to is important. And that's going to really start breaking down that stigma 100%.
Totally. Couldn't agree with you more.
So I know you already said it, but give me the website one more time and I'm going to throw it up as a banner.
Yeah. So it's just www.collectivehealthpartners.com. And that is probably the best resource for us because you can, submit referrals, get questions answered, connect with us on social, all that good stuff. So yeah, there it is.
Awesome. Right down there, right below. And this again is for anybody if you want to go in person. It's in Colorado Springs, a new one in Pueblo as of next year. And then also you said anybody across Colorado can utilize any of the virtual services too.
Totally. Yep. We have a really cool sort of voice activated 360 degree camera system that I think helps create a cozier, more intimate feel for the virtual piece, which some people are concerned, about. It's, there's sometimes can be a lack of intimacy there. But, I think, we took the steps necessary to try to diminish those as much as possible. And so, yeah, we can see folks all across the state.
That's awesome. And the virtual portion, is that still group?
It is. Yep. Yep, it'll still be grouped, and it'll cover the same curriculum and provide all the same resources, and it's very easy to navigate through. So
That's awesome. And one more question that popped in my head. Why do you feel like group is why is it so effective?
yeah, well, I mean, so there is a difference between group and intense, like an IOP, and I don't want to confuse the two because they are a little bit different. Data suggests that they're different, but I think at the end of the day, whether regardless to what type of program, group settings are great across the full spectrum of behavioral health because you get a support system, right? You get other folks, and other peers who have gone through similar struggles, who have gone through things that can oftentimes really resonate with you as an individual. And so to have that community, it can really lead to some long lasting resources, and I think, for instance, our alumni program would be, an example of that, where even though you're discharged from the program after, roughly 8 weeks, it's not, hey, there's the door, it's very much like, hey, this is our community. We want you to stick around, be part of this, stick around with the people that you met. And so I think there's so much good that can come from that sort of setting.
Yeah, it's definitely, community connection, all of it, even the people that feel like they're introverted, we still need other connections and community. And I know I've seen that a lot too, is when you have that community, you have that connection, it just makes you feel like you're part of something bigger. And I
Totally.
love that you have the alumni. That's awesome because it's not just like, okay, we're going to help you and then never again, right? They actually still become part of the community and get a chance to be with the people that they've gone through this with, because you never know again what might come up at a later time.
Totally. No, absolutely.
Well, this was amazing. I'm going to show one more time the website. Go to collectivehealthpartners.com and check out their services. But James, I so appreciate you being my guest today. And maybe I can bring you guys back when cameras work. It's fine though.
No worries at all. We really appreciate you, Kelly. This was awesome. Your line of questions are very thoughtful, and I think, create an awareness and an education that's very much needed, across our country, across our globe. So thank you so much again. And I look forward to staying in touch.
Yeah, absolutely. Thank you so much. I appreciate it.
Of course. Yep. Have a good week.
All right, y'all, that was another amazing episode of Make Mental Health Matter. I'm telling you, all the guests that I bring on are just incredible. And the whole point, again, of Mondays is to bring you resources, information, people resources that maybe you didn't know about in the past, but now you do. Maybe you know somebody in your life that might be struggling, or you know somebody, or maybe you are yourself and you need that resource. That's really the whole point of Mondays and why I have these conversations, because these are the most important conversations. And if you're not having them at home, like James said, I highly recommend that you're having those conversations. You're talking about your mental health. Again, mental health is your brain. Not everybody experiences a mental health challenge, gets diagnosed, or has a disease or illness, as I call them. But we all have a brain and we all have mental health. So we need to start talking about it and taking care of it and really having those hard conversations. And I appreciate you sticking around and being patient with the new platform. I'm going to start learning this platform even more. We'll get back to regular. I know you probably had no idea, but that's the fun part about being live, is that I can really share with you what's happening in the world of the show. And no matter what you do, make sure you come back on Wednesday. I will go live at 7 p.m. Mountain Time, and then another episode next Monday at 11 a.m. And my guest this Wednesday is going to be incredible also. So no matter what you do, join me back, and hopefully by then I'll know how to actually use this system. I don't know. We'll see. All right. Have a great day. Bye, y'all.